Hello and welcome to our broadcast. I'm your host, Brett Barrow. As a reminder, the information provided during this event is for educational purposes only. It is not intended, nor is it implied, to be a substitute for professional medical advice. If you have any questions regarding medical conditions or treatment plans, please consult your physician. Now let's begin. Joining me during this live event is Dr. Matthew Hansen, Director, Washington State University Internal Medicine Residency Program, and hospitalist at Providence Regional Medical Center, and Dr. Delaney Poulet, Associate Director, Washington State University Internal Medicine Residency Program, and hospitalist at Providence Regional Medical Center. You guys have some very long titles, but thank you so much for being here.
It's our pleasure for having us.
So before we delve into what we're going to discuss today, can you guys both give us a little bit of an idea of what you guys do at Providence?
Yeah, so I'll go ahead and start. As you mentioned, I'm the program director for the Washington State University Internal Medicine Residency Program. And basically what that entails is being responsible for developing and overseeing, as well as implementing, the physician training program. And then also ensuring that our residents really have the acquired knowledge, skills, and attitudes necessary to enter independent practice competently. And as you mentioned, I also practice inpatient medicine up here at Providence.
Yeah, and like Dr. Hansen, I also practice inpatient medicine during my day job, and I'm also part of our hospitalist leadership team, integrating our operations with those of the hospital. And then I am the associate program director for the residency program, also helping ensure a strong curriculum for our learners and integrating their experience with our patient care in Everett.
And so can you guys tell us what the internal medicine residency program is and when did it get started?
Yeah, so the program is really designed to provide advanced training in the discipline of internal medicine for individuals who've recently graduated from medical school. The program's been under development for probably 2 to 3 years, which was really challenging in the setting of this current pandemic, particularly given the magnitude of the current pandemic. We were very fortunate to be given a blank slate. It's not every day you get the opportunity to start a new training program. And so with that, we were very intentional and thoughtful about what constitutes the ideal physician training program and how can we create that ideal state. But we also wanted to keep in mind, what are the medical needs of this community? And larger than that, what are the needs of the state of Washington?
So how long do residents remain in the program?
So we have 2 different types of internal medicine residents here. We have categorical residents who intend to practice internal medicine or go on to do a subspecialty training after. And we refer to them as categoricals in our program, and they're here for 3 years to train with us. And we expect to help empower them with all the knowledge they need to be a great internal medicine physician. There are 12 of those in our program per year. And then we also have 4 prelim positions. Those are folks who plan on going into other specialties such as ophthalmology, anesthesiology, radiology, but they need a 1-year internal medicine training program with us in our program before we send them off to their main specialty. And that's 4, so total 16 residents, 12 of which will be here for 3 years with us.
Wow, that's incredible. So what drew each of you to the College of Medicine?
Yeah, for me, it was a combination of things. WSU really takes an innovative approach to medical education, which I think is really necessary for the ever-evolving field of modern medicine. The other thing that really drew me to the College of Medicine was their mission. The WSU is strongly committed to caring for the underserved and rural populations of Washington, which I think are groups that are often left out. And I think that was the biggest draw for me, honestly.
And similarly, the mission of Washington State University really resonated with me. We, in our day experiences as hospitalists, see a lot of underprivileged patients coming through our doors, and knowing that that is the main mission of our program is to take better care of these folks and empower our physicians with the skills they need to care for these populations made me really excited to be a part of it. And then selfishly, I really love being involved in specifically resident education. It's a really fun time in their training to get the last skills they need to go out there and practice independently. So I was very excited about working with the learners and helping them experience all that Everett has to offer in terms of medical education.
On that note, what makes this internal medicine residency program really unique?
Yeah, there's several unique aspects to our training program. I would say first is our balanced approach to training, as our residents spend roughly equal time in both the inpatient and outpatient setting. And what I mean by that is they spend half their time in the hospital taking care of those acutely ill or more critically ill patients, and the other half in clinics, in the clinical experience where folks are typically a little less ill. Second is the diversity, the experience that we've integrated into our training model. And Delaney, do you want to highlight a few of those?
Yeah, I'd love to. So because our goal is to train general internists, people who do not go into specialties, that's definitely one of our main goals, as that's what Washington State needs. We've focused a lot of attention on our outpatient training in the ambulatory setting, trying to create great primary care doctors. And with that, we've had the chance to build a brand new ambulatory clinic for our residents to practice in. This clinic is located on the Providence Everett campus, and we're really focused on, over the next 5 years, creating a value-based care model that helps take care of patients and let them access the care that they need in the way that makes sense in their lives. So improved access to care, meaning in-person visits, telehealth visits, home visits if needed, supported by residents who have preceptors by their side helping them learn the most up-to-date medicine. We integrate an interprofessional care team model in the experiences. So residents work alongside mission-driven MAs and nurses, as well as social workers and psychiatrists in our clinic, all to deliver care to underserved patients who maybe couldn't get that wraparound care somewhere else. Additionally, we're adding in specialists to our clinic over the next year to be able to bring that specialty care to our underserved populations who maybe don't have transportation to get to 3 or 4 specialist visits. So we're kind of building a new clinic model here, and we're really excited to expose our residents to that and empower them to take care of the whole patient in this model. Additionally, I wanted to touch on one more kind of unique outpatient experience that we offer. The Everett Clinic, one of our main partners, has a personalized care team model in the outpatient setting where they take care of the 3 to 5% sickest Medicare Advantage patients in the Snohomish County population. And with that, all of our residents train in that setting with one of our core faculty, Dr. Emily Savage, and they learn how to really support patients who need kind of high acuity and frequent medical care and help keep them out of the hospital and optimize the quality left in their life.
Wow.
I'd mention is that, outside of that strong clinical training, particularly in the outpatient setting, our program really emphasizes community outreach. For example, we've partnered with Mercy Watch, which is a street medicine organization, to integrate a unique experience where our residents go out into the community and bring care to where patients are. For example, during the street medicine experience, they care for patients at needle exchanges, at tent encampments, shelter, mission sites, really trying to make a difference in that community. In addition, we're in discussions right now with the Tulalip tribe to create a longitudinal clinical experience, as well as a didactic series to increase awareness of the healthcare disparities impacting American Indians and Indigenous American populations. Again, hoping to just really make an impact in the community. Our program also focuses on really work-life balance, trying to maintain some sanity for our residents in what can be a very stressful and demanding time.
We actually got a question from the audience. So we got a question from Facebook. So the question is, what I wanted to ask is your program's outlook what is your program's outlook on IMGs? Is it going to be a holistic review or just score-based? I don't know if either of you on this.
That's a great question. We actually were going to address that at the end, but our program feels strongly that it's sort of mission above all else. And we take our mission in mind when we're recruiting faculty, when we're going through our recruitment season for our new incoming residents. And we spent a lot of time working with the College of Medicine to develop a holistic selection method where we focus on individuals as a whole. We don't just look at scores, we don't look at schools. We really want to focus on life experiences, distance travel, commitment to underserved populations, as well as commitment to general medicine or primary care. So we don't really just take that traditional approach of scores and medical school.
Yeah, and if you look at our first class of residents that we matched, that fully supports our holistic mission-driven process of recruitment. We have folks from 5 or 6 different countries represented in our first class with a very wide array of previous experiences in training and in life. So we've been excited. I did just want to take a quick second to finish with a few of the unique parts of our program. I think one of the huge points of emphasis for Washington State University and our program in Everett is reaching the rural population and training generalists who are exposed to rural training. And so we do offer, or actually we require rural training experiences in our second and third years in some of the smaller communities in Washington State to attempt to expose residents to what life and work can look like in those smaller communities. I think it's a very unique experience to be able to practice in a clinic and take care of patients during the day and then go grocery shopping at night and run into those same patients in the community and see what it really means to take care of folks from the same family in multiple generations. And so in the second and third years, residents train in rural communities with the hope that they get to know the community there and love it and are willing to go back after training. And then in the bigger picture, actually expand our network of physicians and consult services outwards through Western Washington and then the rest of Washington. And then the last point of emphasis I wanted to place for our program is a longitudinal advocacy curriculum that we start in the first year and that empowers residents to have the tools they need to use their voice to make change in the system. I think COVID has really highlighted some of the weaknesses in the healthcare system and inequities, and residents in their first and second year really are in the trenches of care and see the populations that are left out and can't access care that they need, and using that voice to make change is important. And I think a really great way to offer sustainability in careers is let people learn how to talk to legislators, learn how to write, to use their voice. And those are the tools we offer throughout that curriculum.
It sounds like an incredible program, but, you guys have both sort of already touched upon this, but is there anything else that you guys want to add in terms of how why this residency program is so important to its community?
Yeah, I think, the big thing is that Snohomish County is growing, right? And as well as that, it's aging. And unfortunately, over the years, we've noticed that this population doesn't have the adequate access to healthcare that it needs, particularly primary care. And we hope to improve this healthcare shortage and improve healthcare access, and with that, improve outcomes. And in addition, central to this program, as you mentioned, is community outreach. We really want our residents, as well as our faculty to be visible in the community that they serve, out there making a difference. And whether that's through service, research, health fairs, or as Dr. Goulet mentioned, advocacy, we really want to show the community that we care and that we're here to make a difference.
Yeah, I would also just highlight that the Everett community, I think, has a ton to offer in terms of medical education, and the medical school at Washington State started 4 years ago, and we were all incredibly excited to celebrate their first class graduating, and we've all gotten to work with those learners and see their strengths and realize just how much the community has to offer. And so this is another really exciting kind of evolution of that, we get to take advantage of the strengths that the strong medical community offers here in Everett and kind of highlight that to the world, that we really do have world-class medical care here. And we'll train our next generation of doctors in that setting.
Which sounds like it's needed more than ever now. Dr. Goulet, you actually mentioned, a little bit about the disenfranchised, communities. And so can you give us an example of how you and your physician residents are building relationships with these members of the community that, especially, one of you, I think it was you, that highlighted sort of how we've seen the inequities more, especially during this time of COVID. So can you give us an example of some of the things you guys are doing?
Yeah, definitely. I would say Dr. Hansen referenced this, our experiences with Mercy Watch, and he has spent more time in that program than I have thus far, though all the faculty will be involved. But for instance, he and one of the residents a few weeks ago took care of one of the patients who presented to a needle exchange site. So that patient, had a day job but doesn't have insurance and also uses IV drugs. And in Everett, those patients can present to a needle exchange site anonymously and trade in their dirty needles for clean needles. But what's also offered at that site is community resources, and medical care, free medical care. And so we are part of that free medical care. They lanced some abscesses and gave antibiotics as needed, but that patient got to know the resident and Dr. Hansen and develop that trust. And with that, we were able to inform that patient that we do have a clinic, and it's the same trusting, supportive folks who are non-judgmental in their care of that patient and their life experience, and that we would love to provide care in the clinic when they need it, so that they would have more of a 24/7 approach to care as opposed to a once a week needle exchange that's open for just a few hours. And so that patient did end up coming into our clinic to receive medical care, and hopefully that enables us to provide the preventative care that that person deserves, and not just the after the fact, I have an infection and need it treated. And then we reduce emergency room presentations for these abscesses, and that then develop to sepsis or full-blown infection in that patient. And so our hope is through experiences like Mercy Watch to establish more one-on-one personal connections with folks who maybe haven't trusted medical care in the past. We bring them into our clinic. Maybe then we also offer resources for COVID vaccination. So one thing leads to another, and we just help the Everett underserved population become more familiar with supportive healthcare providers. And then I would also mention that in our clinic, we are offering telehealth access for people, say, out in Granite Falls who don't have transportation to make it to every visit. We're able to offer, alternating visits, come into clinic, establish care, and then let us take care of you virtually, over your phone, or do some telephone visits. And then within the next year, because we have residents and extra faculty, we're creating a home visit program to do more wraparound care and actually go to people's homes who can't make it to clinic, but who have to keep presenting to the emergency room. And not only does that take care of these individuals who need health care, but it also helps our hospital, which currently is actually overflowing with patients. And so I think it's a whole community approach to medical care.
And I would just add, if I may, really from my experience in street medicine, working with this vulnerable population, it often takes bringing the care to them, on their terms in a non-judgmental way. A lot of these folks who are experiencing homelessness or are struggling with addiction issues can be, weary of the healthcare establishment. They may feel judged. They may feel that they're not, listened to, or they're not heard. And so if we can make that first contact at a needle exchange, at an tent encampment, at a mission to respite bed, and then plug them into the care system, we can really improve outcomes in this, again, very vulnerable population.
Yeah, and the same thing goes over the next year. We've been in talks with migrant worker clinics in the area. Again, we mentioned the Tulalip tribe and integrating some of our providers into care long-term there. And so that is the goal across Snohomish County.
Yeah, building that trust is, I think, really key.
Yeah, definitely. How are Providence and WSU aligned in their organizational missions? I feel like this was a little bit touched upon, but if one of you wants to address this again, that would be great.
Sure. I think, mission alignment is one of the big reasons why this partnership has been successful. And I'm going to paraphrase a little bit here, but Providence mission is really to care for the poor and vulnerable. And WSU is to improve the care for underserved and rural populations. And so I think that overlap has allowed both organizations to jump on board with the mission of this program, which is sort of a hybrid of both, and have offered us nothing but support. And without both organizations, we certainly would not have been successful in launching this program over the last couple of years.
Dr. Goulet, do you have anything to add? No?
No, I mean, it's just been a pleasure seeing the two sides come together because the missions are so aligned. And it's been fun because I think there were a lot of people who maybe have been pulled into the patient care side on the Providence side who haven't gotten to participate in education, who have really enjoyed that aspect of this program.
We actually got another question from the audience. So the question is, since this program is so new, what has been the big aha so far? Or has there been any big aha so far?
Yeah, I'll take a stab at that, and I'd love to hear from Dr. Goulet as well. My big aha was, okay, we've been working on this program for 3 years, and you think you have everything figured out. And then you put a learner in the environment and you're like, wow, that didn't go at all how we planned. And then you have to pivot. And so, hearing from our residents has been just so incredibly valuable as to what's working and what's not. And then through this, process of continuous quality improvement, really always seeking to be better, always seeking to make the best training program possible, I think is just the mentality that we're all taking, because again, there's a million little things you just didn't think of when you were sort of going through the mental exercise of making this program.
Yeah, absolutely. I fully second what Dr. Hansen said. And I would also just mention that with all of that time for planning, we became very excited about all of the extracurriculars, our quality improvement experiences, our community outreach experiences. And the second that the learners hit the ground here in Everett, it immediately took me back to my, orientation week and my intern year. And for just a second, I think all of us who have been so revved up to get this started had to just take a deep breath and go, okay, the little things first. How do you get through awards day? How do you get through a clinic day? How do you sign on to the electronic health system? And where are the bathrooms? So it's been really fun to help them through those first steps. But we're more excited to continue to roll out all of the extra pieces that we think will enrich their experience.
It sounds like an incredible program. We actually got another question from the audience. So how is health equity being applied or included in your residency program? P.S. Good work, great work.
Yeah, I'll address on a few of those things. Certainly, our experiences that are not add-ons, right? It's not we're asking you to do this. We're actually substituting this for a different part of the curriculum. Things like, street medicine, right? Where every one of our residents will rotate twice a week through street medicine, right? So we are delivering care to, again, those folks who are really experiencing healthcare disparities, right? They don't have access to the care they need. They don't have access to medications, clothes, oftentimes food. And so, we're out there delivering care to those individuals. And that, again, that's a mandatory experience in our residency. The other thing is our clinic, our continuity clinic, is acting as a safety net for the community. We are, caring for uninsured individuals. We are seeking out those folks who don't otherwise have appropriate access to care, like via the traditional venues, or don't have insurance. And so, again, trying to deliver care to those vulnerable populations. The other aspect is, Dr. Goulet mentioned, is rural health. All of our residents will do 2 months of rural rotations to experience what it's like to live and work in one of these rural communities, where oftentimes, there isn't appropriate access to primary care or subspecialists. And we, really hope that this will entice some of our residents to return to live and work in these rural communities after graduation, but also provide a support system for these physicians who are working in a rural community who may feel isolated at times.
Yeah, and then in addition, we have curriculum set aside on both advocacy and quality improvement. And I think both of those offer a huge amount of space to do work on health inequities. So for instance, for our continuity clinic, we have pre-clinic conferences every week. And with that, a number of those will focus on the social determinants of health. And because we've partnered up with our quality folks here at Providence, we can actually look at metrics and separate those by different populations. So uninsured versus insured, who's getting their preventative screening done, who's not. And then we can turn around in our quality improvement curriculum time and say, you know what, I have interest in figuring out how we can improve our colonoscopy rates for our underserved populations or uninsured populations to equal that of those with commercial insurance. So these are the kinds of projects we're looking for specific resident interest in. And if those are the interests that our learners have, that's what we will focus our quality improvement projects on. And through the advocacy curriculum, the platforms that we go talk to local legislators on will be chosen by the residents. So certain platforms that we'll introduce this year are the health inequities that maybe our Latinx population has faced in terms of the COVID pandemic. What changes do we need to make in terms of education and literacy for non-English speaking patients to get them better education? And is that something we can help develop and roll out in our clinic or in clinics around the area? I know that the Tulalip tribe, when we spoke about creating education for their patient populations on vaccination, they were incredibly interested. And so residents will drive the goals of our quality improvement and advocacy curriculums, but we will certainly be offering a lot of ideas centering on the inequities that we've seen here in Snohomish County for those projects, and then the support to get it done within actual curriculum time, as opposed to asking them to do extra after their long clinical days.
And two of our residents have actually already implemented projects. And I think this gets back to our holistic selection method. We are really seeking like-minded individuals who have that mission in mind. So, one of our residents implemented a project to provide insulin to those experiencing homelessness in the Everett population, in the Everett community, and also allowing an area for this to be refrigerated. And another one of our residents actually instituted a clothing drive. And again, they've only been here for 6 weeks. So, I think that's, deserves some applaud for what our residents are doing. They're just getting their feet under them from, a training standpoint, like learning a new system, all of the demands that go with physician training, and they're still taking their, free time to implement projects to serve others. I couldn't be more impressed by this group of individuals.
It's absolutely amazing. So how would people find out more about this program?
Yeah, certainly we have a website, WSU, if you just Google WSU GME or WSU Internal Medicine Residency, we have, and there's the-
And I was gonna say.
There we go. And you can also certainly email us. We have an email address for the program specifically, and we're happy to answer questions.
And we are wrapping up. We're getting ready to hit our time max here. But do either of you guys have anything else that you want to add before we sign off on this? This program sounds absolutely amazing, and thank you so much for sharing everything.
Yeah, I think two things I would like to highlight. One, big thanks to the Everett medical community. This would not have been possible without all of our community partners, the Everett Clinic, Providence Medical Group, Western Washington Medical Group, Snohomish Kidney Institute, Mercy Watch, North Sound, emergency physicians, et cetera. This is really a community effort. And then obviously Washington State University and Providence Medical Center. Everett, thank you for all you've done to make this successful. And then two, just that, mission this is a mission-driven program, and every decision we make We try to keep the mission in mind. Again, really serving underserved populations and rural health. So I appreciate your time so much.
Yeah, and whether it's patients listening right now or potential future faculty or future residents, we're excited to meet you and learn more about you, and really excited to just improve the care of our community.
Thank you guys both so much. Today has been so educational and informative, and it just sounds like such an incredible program. And thank you to everyone for listening and sending in your questions. If you are looking for medical advice, please visit providence.org and make sure to follow us on social media at Providence on Twitter and under Providence Health System on Instagram, Facebook, and LinkedIn. And thank you again for being here. We will see you guys soon. Bye.
Thank you.